My name is Jasmine Cortez, and today I will be teaching you about one of the 5 senses. My sense is smell, also known as olfaction. Smell, like taste, is a chemical sense that gives us the ability to detect the molecules in our surroundings. It is important to be aware of the toxins and volatile chemicals in your environment. Because of this, smell is a crucial survival skill in the early ages. In the present, it is used more to detect what you are attracted to rather than a survival skill. Some of the organs involved with olfaction include the brain, particularly the temporal and frontal lobe, and the nose. The pathway of smell starts off with olfactory cells making their way to the nasal cavity. Once this happens, olfactory transductions occurs and bind to the olfactory receptor proteins on the cilia of the olfactory receptor neurons. Electrical responses in the cilia spread to the rest of the receptor cell, and from there are passed on to the olfactory bulb of the brain in the olfactory nerve. From the olfactory bulb, mitral cells and tufted cells carry olfactory information to the olfactory cortex and to the orbital frontal cortex. There are about 1,000 different types of receptor proteins, each sensitive to different odorants. There are about 10,000 different odors humans can tell the difference between. Another interesting fact about olfaction is that it affects the limbic system. The limbic system controls basic emotions like anger and happiness, while also controlling people's drives for hunger and other things. An example of this would be things you are attracted to. When I smell French fries, my brain releases dopamine to show that I am happy or excited. When I smell pickles, however, my brain does the exact opposite, remembering how much I dislike the smell. Because dogs can be 10,000 times more sensitive to odor than humans, I put this to the test with my dog Kuma. So now that we have established what smell is, we can discuss what kind of pathologies affect the sense. Nasal polyps are painless, non-cancerous growths on the lining of the nasal passages. They can result from long-term swelling and irritation in the nose from allergies, asthma, or infection. Nasal polyps can cause breathing problems and a lost sense of smell. Medication can shrink or eliminate polyps as well as surgically removing them. While these two things certainly help breathing problems, it is not guaranteed that you will get your smell back. Another pathology of smell is anosmia. This is partial or total loss of smell due to respiratory infection, smoking, cocaine, etc. A person without a sense of smell is deprived of an early warning system. Smell and taste alert people to fires, poisonous fumes, leaking gas, and spoiled food. It also greatly affects the taste of food, leading to a smaller palate. Decongestants, antibiotics, and surgery for obstructions are all possible solutions for anosmia. Unfortunately, anosmia is not always treatable and therefore might be something a person must get accustomed to. The last pathology I have to speak about is rhinitis. There is non-allergen rhinitis and allergen rhinitis, which can be known as stuffy nose or hay fever. This is the inflammation of the lining of the nose. It can be caused by environmental or occupational irritants, weather changes, hormone changes, and certain medications. Ultimately, rhinitis can hurt your sense of smell even more by creating nasal polyps. Nasal sprays are the #1 medication for relief. They can be saline, corticosteroid, antihistamine, etc. As we grow older, our sense of smell does begin to weaken. Although we are at a greater risk to succumb to one of the diseases, this does not mean we will lose all our smell. Some people will lose minimal of the sense while others lose more. Besides losing smell as we grow older, olfaction has been evolving in humans. With the evolution of smell comes the evolution of human diet, habitat, and social behavior.